Emma and Adam from Wetherby. How does it feel for me? June 2021, Part 3. How does where you live impact accessing health services?
Not so much from a physical health perspective. It's fairly easy to do. We can pick to go to Harrogate or Leeds when we need to access physical healthcare. If I needed physio, I could go to whichever options that are there. When it comes to mental health, it gets a lot more complicated. So because we're in the northeast, a lot of the inpatient northeast of Leeds, our inpatient and community mental health services are paid for by the CCG, the Leeds CCG, to be delivered by a mental health trust that's based in Harrogate and kind of North Yorkshire. But that means specifically inpatient, so if you needed to be in hospital, and community services, so that's a care coordinator. Unfortunately, anything a care coordinator might suggest you go to normally, such as like therapy groups or session support services and that sort of stuff, tend to be in the area that they work in. So a lot of employment services. So recommendations for, because they're in Harrogate, are recommendations for Harrogate, but we can't access those services because we pay council tax to Leeds. So even then, when we do find services in Leeds that could be done, where are you based? Oh, we're in northeast Leeds. Well, you need to get that from Harrogate. But the nearest support group by Leeds Mind is in Horsforth. There's a 2-hour bus ride if you don't drive.
And it's then even if I do find something in Leeds, not driving myself and him working full time, so he can't really get me to places. Even if I do find something to access in Leeds that I am been told that I can come to because we found somewhere who will accept me, I often sometimes can't get to it or give up on continuing to access it because it's so hard to get to for myself. Autism services is split between Leeds, is more towards Leeds side as well. I mean, I know my care coordination and CMHD have now accepted sort of like joint autism and mental health patients, but they don't actually offer any autism services. So I'm getting a more holistic approach from the team and they understand it more. But any services I want to access are in Leeds, and they're all in such random places in Leeds and very hard for me to get to.
How have you found the communication between different services?
Based on where we live, I think it's hard enough within services that within the same area to communicate with each other, as in like to know what current services I'm accessing. And when you're split across two areas, sometimes Leeds is usually for the physical health, but sometimes also Harrogate. And then Harrogate is for the mental health, but then sometimes also Leeds, but they never talk to each other. And so then my care coordinator suddenly went, "Oh, so you've been seeing the social prescribing team in Leeds? We didn't know this." And then it's like, so there's just no communication whatsoever, even when it's mental health related and they should be talking. And autism between mental health services, they don't talk to each other. So even though the current autism services that I'm in don't talk to the mental health and vice versa, so nobody really knows where I'm at. And then people then duplicate something like, as well, like, "Oh, we should get you sorted with employment support." And I'm like, "Oh, I'm already with it." And they're like, "Oh." So it wastes time as well as it making it difficult for us to keep. We have to hold all the information ourselves.